Thank you, Professor Lee and Professor Kim, for kind introduction. It's really great to see you in face with our specimens. My talk would be, the title is very broad, but I would concentrate on introduction of heart specimen observation at this time. This is my own picture I've taken during when I was resident in pathology. It's not uncommon to see the human embryo of this size from the tubal pregnancy. So after cleansing and everything, we can see the right atrium, left atrium, and left ventricle and right ventricle in a kind of connection of bulboventricular morphology at this time. Liver covers very big space in the abdominal wall. And this is also our own picture with a chick embryo grown in the egg and a kind of a chick fetus to be developed later on. And also, this is not my own picture, but we can grow the mammalian embryo, such as mouse embryo, by in vitro system to cultivate this big size. And then we can examine those heart by scanning electron microscope, and also we can use cryosectioning to make a sharp cut surface like echocardiography of the human body or CT scanning of the human. Remodeling and development is closely observed through the immunohistochemistry that has been discussed already by our colleagues, pathologists, and then from now on, we are going to examine the heart with our own hand to see what is here and how we can treat them, and so on. The frontal view of the adult heart and children's heart is like this, and lateral view is like this, and internal view would be like this, and atrial wall and right ventricular wall. And also sectional surface, we are very familiar with this long axis, parasternal long axis view. And also we can examine through this view, like a surgeon's view, to examine the right atrium and right lung from my side, and Waterston groove and this area, and also pulmonary vein and superior vena cava, inferior vena cava from upper and lower part of the body. So anatomy is a representative of human, and anatomical principle means we can observe purely morphological basis, but we have to consider what has been done before this morphology, which is developmental concept. Development may be the structural development through our understanding of the adult developed heart, or we can examine this heart through developmental biological technique like culture and immunohistochemistry and so on. But also clinical pathology experience is very important for our observation. So step-by-step analysis and we consider the common and rare conditions, and also we can think about how we can make some kind of a hypothesis, and we can find through proving this hypothesis, finding very rare conditions of the heart and so on. Segmental analysis is now less value for current cardiologists, but it was a kind of classical approach to human malformed heart. The reason we are not very much interested in this segment system is we are not dealing with such a very, very complicated heart. Rather, we can use a Fontan procedure or later on transplantation and so on. But simply, we have to understand these approaches from Maria de la Cruz in 1960s, and Richard Van Fra in 1970s, and Bob Anderson in 1980s, and so on. So visceral atrial situs, that means visceral situs and atrial situs are very much common usually concordant. So it may be usual type, solitous type, or inversus type, or it may be ambiguous, which may be it's not solitous, not inversus, but something else. That means we are talking atrial situs ambiguous. Ventricular loop is a developmental concept that dextral loop and levo loop is a developmental process how we can understand the abnormal position of the right ventricle on the left side and so on. Great artery is also classified into 4 types, and whether the aorta is anteriorly located or posteriorly located, and then posterior aorta is on the right side, it is solitous, and left side is inversus. D and L transposition, that means that transposition means that the aorta is in front rather than in the back. It really doesn't matter at this time for which ventricle is connected from these transposed aorta. But the understanding is that transposed aorta is almost always connected to right ventricle, whether it is on the right side or on the left side. That's a kind of rule which we call loop rule. So by combining this system, we can see SDS is a normal heart, SDD is a complete transposition, and SLL means that ventricular loop is abnormal such that left ventricle is on the right side, and in this case, usually anteriorly located aorta is on the right, on the left side, on the right side, on the left side, left side, L, and then physiological correction is made in corrected transposition. So segmental sequential analysis and a kind of a little bit modification, upgrading of this system. So atrial appendage can be usual mirror imaged right isomerism and left isomerism. Ventricular relation is not changed very much, and arterial relation is similar to the previous one. And then atrial ventricular connection may be concordant. That means right to right, and discordant means right to left. And absent left-to-right connection and VA connection is also concordant. That means right to pulmonary artery, left to aorta, left ventricle to aorta, and so on. So we can draw the diagram and make some simplification from the basal aspect of the heart, but it may also confusing to somebody. So we don't have to keep this too much, but we can understand there are normal heart, complete transposition heart, and corrected, and the other page is corrected transposition. As we have discussed at the very first lecture at the beginning today, bulboventricular malformation is on this type of ventricular arterial, atrioventricular arterial morphology. But through this anatomical principle, we can make a hypothesis in practice, and we can examine autopsy the heart or transplanted resected heart, and also we have very good modalities for medical diagnosis and surgical treatment procedures. I have modified the previous series of my heart specimen that it was 10 hearts in one panel, but I found it rather 5 hearts in one panel would be more convenient for you to carry and move. So VSD has 3 panels. I had one mistake. The one VSD 1 is in different colors. So just VSD 1 to 3 are there, and AVSD is this green color. QF is in cyanotic color. DORV is a kind of purple color. Complete TGA is a more cyanotic. Corrected TGA is a kind of smiling yellow color. So we have 3 CCTGA 1 to 3, and individual has at least 3 or 4 or 5. And the bottle has some number, but just disregard this number. But it means 3 is ABSD and 5 is TOF and so on. And this is the current distribution system. So this is stage. To here is a CCTGA. 1 and 2 are there. So pink VSD is here, ABSD is here, DORV, TGA, and TOF. So if you want to examine some specific topic, you can go and join them, and your colleague and your senior will explain the hot specimen, and you can enjoy learning from your seniors and your colleagues and surgeons and cardiologists. So after my talk, there will be another talk on conduction system, and then you are examining the hot specimen for 2 hours, including these lectures. That means you have 4 hours today and 2 hours tomorrow, and you have to examine everything. And also, you have your pamphlet printed version of this paper that will be distributed very soon. You can use that printed version and check and so on. Thank you very much.